Hello, and welcome to the American Lung Association Better Breathers Club online member series. Today, we'll be talking about maintaining lung disease amid COVID-19. But before we get started, I wanted to remind you that at the bottom of your screen, there are multiple application widgets that you can use. And all of the boxes are resizable and movable, so you can feel free to move them around and get the most of your desktop space. For the best viewing experience, we recommend you use a wired internet connection and close any programs or browser sessions that are running in the background that might cause issues. And for the best audio quality, make sure that your computer speakers or your headset are turned on and the volume's up so you can hear the speakers. And make sure that the media player on your screen is enabled. If you're having any technical difficulties, you can let us know in the Q&A box at the bottom of your screen. And if you have any questions or comments as we're calling out and asking for those during the webcast, you can put those in the Q&A box as well. This webcast is being recorded. It's going to be available tomorrow, and you can access it using the same link that you used to register. A quick note for you and a reminder that the presenters can't give medical advice during the webinar, and you should always consult your personal physician or your healthcare provider if you have any questions regarding your specific medical condition. And now I'd like to welcome you officially and thank you for joining this week's webinar. For more than 115 years, the American Lung Association has been a champion of lung disease and lung health and healthy air. And today, we know our work is more important than ever. I commit to you that we're steadfast in our mission to save lives by improving lung health and preventing lung disease through research, education, and advocacy. And without going too much further into that, I'd like to introduce to you our speaker for today. I'm super excited for you guys to get a chance to hear from my colleague, Debi. Debi Hollaway is a registered respiratory therapist and a nationally certified asthma educator. She has almost 20 years experience providing lung health education to patients, and she loves Better Breathers Clubs, which is one of the things I really appreciate about her. Debi's currently working at the American Lung Association as a national senior manager. She's passionate about lung health and providing resources to patients. She lives in Phoenix, Arizona. And now I'm going to pass it over to Debi. Go ahead.
Hi, thank you, Beth. Well, good afternoon, everybody. I'm really excited to be here virtually with all of you. So that's me, and we're going to go ahead and start with our presentation. So today we are going to talk about maintaining lung disease during COVID-19. And we do have some learner outcomes. So hopefully at the end of this presentation, you're able to know steps to better manage your lung disease, recognize the triggers that worsen lung disease, discuss self-management strategies, and tips for virtual doctor appointments. And throughout our time, we will have discussion and sharing. So please feel free to use the Q&A if you have any questions that you would like to ask. We're going to start off right away with one of our polling questions. So if you guys would please respond, which lung disease affects you the most? So put down your answer, and we will go ahead and let you guys submit those answers. And while we're waiting, I do have some club members who's on the phone with us today that will be joining me. And while you are filling that out and submitting your responses, I'm going to start with Karen. And Karen, can you introduce yourself to the attendees, let them know a little bit about you, what state you live in, and if you've ever attended a Better Breather Club, and then how are you doing? So if you can answer the questions, that would be awesome.
Sure. My name is Karen, and I live in Florida. I have COPD. I've been living with it for the past 20 years. Yeah, I have attended better breathing groups in the past. Right now, of course, we can't go, but as soon as they're available again, I will be going again. And I'm doing all right. today was the first day I left my house, and I had to leave my house because my phone died. So I had to go get a new phone so that I could be part of this. But, yeah, I'm doing all right. I'm doing all right.
Well, great. Thanks, Karen, and I'm glad you got your new phone. Okay, moving on. We also have Laura. So, Laura, if you can tell us a little bit about yourself and so on, that would be great.
Hi, my name is Laura, and I live in Connecticut. I have, in 2013, I was diagnosed officially with idiopathic pulmonary fibrosis. On January 17th of 2017, I had a left lung transplant, but I still have, my right lung is still fibrotic, so I still classify myself as having IPF. I started to attend Better Breathers Club in 2013, so I've been active in the program since then. It's an awful lot of great information. I've become a patient advocate because of it, so I'm really excited to be here today. Thanks.
Thank you. And last but not least, let's hear from Renee.
Hi, my name is Renee. I live in Atlanta, Georgia. I have severe asthma. I had it as a child, thought I outgrew it. About 3.5 years ago, it came back with a strong force, and I've had asthmatic pneumonia several times. I was in the hospital for about 1.5 years, every month or so with this double pneumonia. I'm doing great right now, just trying to stay in the house, stay away from people as much as I can, and really happy to be on this call.
Thank you so much. All right, so let's look at where everybody landed. So 51.7% COPD, asthma coming up next in the lead at 15.5%. And as you can see, we have lung cancer. Wow. Boy, excuse me. I clicked a little bit too fast. Let me push this down a little bit here. Pulmonary fibrosis, bronchiectasis. And Bev, was there any other lung disease that maybe somebody didn't use in the polling?
Yeah, we heard from a couple different people. Someone has MAC disease, and someone has hypersensitivity pneumonitis. Those are the two that were added in the other category.
Okay, thank you. Boy, we're seeing a little bit of everything, which is actually really great because we are lung health. So I'm glad that you are all here with us. And we do welcome you to the Better Breathers Club. And if you have not before been to an in-person club meeting, I really encourage you all, once your state is open and once it's available, to go out and to actually register for an in-person. If you can't find one, please reach out to Bev. She can help us see if there's one near where you live. But what you get out of it, I can guarantee you, if I gave you all my email address, you'd go to one and then you'd email me back how wonderful it is. So really, I encourage you. So during today's meeting, as you can see, I do want to hear from everybody, and we will be doing more polling questions. And as a reminder, anytime a question pops up, please use your Q&A box. We're going to now delve into respiratory medications. So we have a little bit, based on everybody's responses, we're all taking a little bit of different kind of medications. So the most important thing is you want to take your medication as it's prescribed. So just like anything else that you take, even if you take an aspirin every day, you're going to do it as the physician recommends you to. We have had in March and in April, there was a little bit of an inhaler shortage. If that did affect you, out of curiosity, I would love to hear from you, so put that in your Q&A. But if it didn't affect you, that's great. For some of the people it did affect, maybe their provider switched them to a medication that was available, or if the medication costs too much, regardless of what that meds are, please talk to your physician about lowering costs to see if there's something else available for you. And with taking medicine every day, if you do run low, You also want to have that conversation with your physician about if you need refills. You know, one of the things that's great to do is secure a 90-day supply of the medications, and better yet is mail order, so it comes directly to you. So here's our next top poll. So what are your top 3 triggers? So while you guys fill that out, we are going to hear back from our little helpers here. So Renee, I'm going to start with you first. Can you share your top trigger? And then let us know how you manage.
Okay, my top trigger is actually, I have allergies on top of the asthma. So pollen, the change of the seasons, especially September, October when the weather starts changing, is a huge trigger for me, and I usually end up with asthmatic pneumonia. So I have to be very careful, and I've learned over time to make sure that I cover up. I cover my chest. I always wear a T-shirt, something cover my neck. But pollen is very bad, and also when the temperature changes about September.
Okay, that's great. And so it's really important that we understand what our triggers are so that we can eliminate or try to avoid them as much as possible. And what about you, Karen?
Well, the trigger that is the worst for me is cold, windy weather. And keeping in mind I live in Florida, cold to me might be hot to you. But if I'm out and it's 65 degrees or so and it's windy, I inevitably get a sore throat, and that sore throat turns into bronchitis. And so, but I'm not going to stay out, you know, I'm not going to stay in my house all the time. There are things I want to do. And if it's a cold, windy day, I'm going to go do it. So what I always do to manage it is I have a prescription for azithromycin and for prednisone on hand, filled at all times, so that I can immediately begin to take it if I sense that I'm starting an exacerbation.
So that's great. You're being proactive. That's wonderful. And Laura, can you share with us as well?
Sure. What triggers me is some very strong smells, which could be perfume, strong candles, smoking, cleaning fluid, bleach. Any of that would trigger me, along with major heat or humidity. It's not the hot that bothers me as much as I couldn't get a breath in at all with humidity. And I too have allergies really bad, so the pollen does affect me quite a bit. But smoking and secondhand smoke, I don't smoke myself, but secondhand smoke, even on people that just had a cigarette, really is a trigger for me.
Thank you for sharing that. So for lung diseases such as asthma and COPD, it's really important, as well as the other diseases for lung health, that we do know what our triggers are. So let's look at our polling results. Boy, a lot for pollen, cold, so that doesn't surprise me. Physical activity and exercise. Let's see as we go down here. And other. So I'm curious about the other. Bev, can you share what the other trigger is?
I sure will. There's been a lot of good comments from individuals. Casey is triggered by dust, and Jude mentioned trees, pollen, and raw onions. Sherry struggles with heat and humidity, and also birds. And one more. Debbie mentioned living in Ohio, temperature changes along with fires and allergies.
Thank you, Bev. So when we talk about uncovering triggers, so I'm glad, first off, that you guys all know what your triggers are. And I'm going to go back here really quick. I just wanted to point out that the most trigger, at least the most popular trigger for today, is physical activity or exercise. And we'll talk about that as we go on, but that was interesting to me. So uncovering triggers. So it's really important we do know what sets us off? What makes it harder for us to breathe? So somebody had mentioned, or you guys have mentioned, the mold, the mildew, strong smells, extreme air, extreme heat. We talked a little bit about secondhand smoke and smoking. I hope all of you who are on the call that none of you use tobacco or vape. If you do, please consider quitting. Secondhand smoke, in my opinion, is just as bad. So if you go to somebody's house and they smoke, kindly ask them not to around you, or maybe you invite them over to your house and they smoke before they get there and then wash their hands. But the bulk of you, the biggest response really was the physical activity and exercise. I know with asthma, if I'm going to get ready to exercise and I have asthma, I can pre-treat, so I can use my quick release inhaler. And so that way, when I do start to exercise 15 minutes later, I'm not as apt to become short of breath. Now, if I don't have asthma and it's something else that really bothers me, I still want to exercise, but maybe I'm going to pace myself and I'm going to modify how I exercise. So there's different things that we can do. If it's animal dander, somebody had mentioned birds. Birds are really high because of the feather, or if you have feather pillows. So some physicians may say, you get rid of those feather pillows and get things that don't have any kind of trigger for you. So thank you guys for all writing down some of what those triggers were for you. Our next poll, we're going to talk about what's most difficult to treat the respiratory system. So you might have more than one or just number one on here. So if you guys can take the time to fill out that poll, that would be excellent. And in the meanwhile, we will go back to our ladies and have them share. So this time I'm going to start with Laura. So Laura, what's your most difficult respiratory symptom and your best tip for managing that symptom?
I don't have any good news with that. I had major dry hacking cough to the point where I couldn't even talk. All I could do was text. The only thing that helped me was hydrocodone, which is a liquid cough medicine, and that would put me to sleep. So that was the only thing that really helped my idiopathic pulmonary fibrosis hacking cough that I had. I no longer really have that cough. I started to have a little one, but that I think was attributed to the pollen that's in the air, and I'm taking something for that. So I think that a lot of us with IPF, it's our really bad dry cough. It's hard to manage.
Yeah, I used to be an educator with a company for idiopathic pulmonary fibrosis, and that was the main complaint that I would hear as well. So I'm glad that for you that's dissipated some, and then when you do get pollen or whatever, you're being very proactive about how you are working with that.
Right. The only way that I got rid of it was when I had a lung transplant.
Okay, thank you for sharing that. All right, Karen, what about you?
Well, my most irritable, difficult to treat symptom lately has been mucus or phlegm. I drink lots and lots of water. I have a device. I've never known how to pronounce it. Is it Arabica or Aerobica? But I have it, and it helps. And I take either Mucinex or the generic guaifenesin to help. But, I mean, you can even hear it in my voice today, I think. I'm constantly having to clear my throat of the mucus. And that's, I don't know how to totally stop it. I don't think you can ever totally stop it. But maybe there's a way.
Well, at least you're using good strategies, and with a mucus clearing device that you explained, and I don't know the name of it either, so I'm not going to try. But I think doing those things, it's really good. Again, I'm going to use that word proactive. So if something's not working, you talk with your provider and you let them know whether your cough is dry, whether you're coughing up a lot of phlegm, and what works for you, and, to be proactive about that. So thank you, Karen. And Renee, can you please let us know about what is most difficult for you to treat?
For me, it is actually the wheezing and the lung infection. And I normally, and this is one thing I have to say, like I said, I have asthmatic pneumonia all the time, but I am one that I never get a fever. I don't get a cough. So I had to learn to really self-manage myself and know my symptoms, and it's so important for all of us over time to really know when you aren't feeling well, when you know something is wrong, because you have to be your biggest advocate. Because if you are not, sometimes it can go bad. But I don't have normal symptoms. So whenever I have the pneumonia or anything, I don't get a fever. I don't have a cough. I know my lungs start hurting, and I have a shortness of breath and a wheezing. But I had to learn that the hard way. So for me, it's a lung infection. So the steroids and making sure I manage my medicine every day, it helps a lot.
That's excellent. And I really love what you said about being your own advocate. So it's really important to everybody who's on the call that if you feel different than what you normally feel and you know something's not right, don't ignore it. Write it down and see. Maybe it's something you think, it'll go away tomorrow. But, really take note of that and talk with your doctor. So you really want to stay on top of things. So thank you so much for sharing that. So let's look at our poll. And we could see here, mucus or phlegm is the highest on our poll. And we come up with next that dry hacking cough, wheezing, I get a little trigger happy. And then let's see at the bottom here, lung infection, and then other. So I'm going to ask Bev again, what is the other that we're saying on here for the Q&A?
Yeah, so Bobby and Sandra and a couple others mentioned shortness of breath.
Oh, excellent, excellent. And did they say did they have any tips?
Oh, I don't think we asked them, but they certainly shared just shortness of breath.
Okay, thank you, Bev. Okay, this slide, it talks a little bit about managing some of those symptoms that you all just told in our responses. So with COPD, shortness of breath, wheezing, chest tightness, the mucus production, and that frequent cough. So really important with patients with COPD. If you notice a change in any of those, or even just one, let the doctor know. So as was said before, something feels different, and if it doesn't feel right, it's okay to call your doctor and say, I'm starting to feel this more. What can I do? And so maybe he'll put you on medication, change your medication, or maybe you take extra breathing treatments, whatever it is, but at least you're having that conversation and not letting it get out of hand. There are also non-pharmaceutical treatments that you could do. So drinking more fluid really helps. Just having to help to thin out those secretions. So I'm going to give you guys my little analogy. So let's pretend I just bought a garden hose. And that garden hose, if I was to look through that garden hose, I would be able to see the inside diameter of that hose really well because it's brand new. I could see the walls, and I could see that opening, and it's nice and clear. There's nothing occluding that hose. Well, let's say now I'm using that hose, and I'm using it in my garden, and I live in Arizona, so what I have a lot of is dirt and sand. Not so much plants, sure about that, but I have a lot of dirt and sand. So what I might be doing instead is now when I look inside that hose, I'm going to see the dirt and the sand, and it might be dirt clots. And as I look into that diameter, now I'm noticing it's getting narrower and more narrow. So my thinking is, well, wow, I've got to get that out. So I'm going to flush it with water, and I'm going to try to thin out that mud or the sand. So same thing with our lungs. So drinking helps to really thin out some of those secretions. And for some, it might be doing coughing, deep breathing, different kind of techniques, even using a mucus cleaning device. I hope my analogy made sense to you guys. Next, I'm going to talk about asthma. So with asthma, and we just heard wheezing, they also can feel the chest tightness, like almost someone sitting on your chest, shortness of breath, difficulty of breathing. And for somebody who, when you take your medication and maybe it's in between time, maybe try drinking something warm, a cup of tea or hot water with lemon, and not too hot, but something to help relax those airways. With pulmonary fibrosis, we talked about that dry, hacking cough, also too shortness of breath and fatigue. And that dry, hacking cough, we already heard she got a lung transplant, which really helped it. But for those who aren't yet at that stage, keeping your throat moist, so maybe it's lozenges, talking to your provider, maybe he might give you some cough syrup or something that you could use, and then think too about the triggers that make those coughing worse. So for some of the patients that I would talk to, they told me if they started talking a lot, it would make them cough. So with anything, any kind of exertion, physical activity, you can always pace yourself and modify how you do things. And last on this list, which is by all means, just a snapshot, we're going to talk a little bit about lung cancer and with their symptoms, worsening cough, hoarseness, chest pain, shortness of breath, maybe lung infections or coughing up blood. And again, lung infections like bronchitis or pneumonia, they can be as well treated by drinking warm fluids. Again, it's getting that warm fluid to help with those secretions to thin them out. And also always talking with your provider. One of the things I really wanted to touch on was mucus. So mucus is, and I'm a respiratory therapist, so we love anything that has to do with mucus. That's also called sputum or phlegm, and it's produced in the airways as a defense mechanism. So our body is fantastic. It does all these things unbeknownst to us to try to protect. So one of the ways of protecting is by increasing mucus. Well, if mucus stays in the airways, as some of you may well know, it makes it much harder to breathe, and you could have risk of infection. So if you think back to my analogy with the hose, if I have those dirt clots in there and I can't get them out, well, eventually maybe I'll get mold or maybe something else different will happen to those dirt clots. Or, and if we relate that now to our lungs, I could get an infection because that mucus is just sitting there. So again, talking with your physician about over-the-counter medications, is there maybe some controlled coughing techniques that you could learn? And also, too, we talked about the mucus clearing device that can be used. There's also a vest. So in my day, we used to actually use our hands and pat on the ribs wherever somebody felt that they had a lot of mucus, so we could actually feel that. And I liken that to a ketchup bottle. So if my ketchup bottle is almost empty, I'm going to kind of shake it and make a little bit of vibration to try to get that ketchup off the walls of the bottle. I might even use gravity to turn it which way and not. And the vest is kind of like that. So it works with vibration to try to loosen those secretions so that when I cough, I'm able to cough them up. Nowadays, with COVID-19, a lot of medical appointments now are becoming virtual or telehealth. But keep in mind, an emergency will always be an emergency. So if that means you need to call 911 or go to urgent care or to the emergency room, please go do that. Another thing just as important, if you don't have a doctor, get a doctor. I recently moved from California, and in Arizona, that was one of the things I needed to do. I'm pretty healthy, but you never know when you might need a physician, so always making and having that establishing care is great to do. Preparing for a virtual appointment, I also had to prepare for that virtual appointment. So my doctor suggested that I had with me a scale. They wanted me to check my temperature, and they also wanted me to do my blood pressure. So they have different things that they might ask you to do. And before I had my virtual appointment, I did write down some of the questions because I'm sure as many of you know, by the time you get to the doctor and you leave, you're like, oh my goodness, I should have asked that question. So again, be your own advocate. Come to the table with questions or things that are really bothering you that you want to talk about and get control of. And then always, too, with that virtual appointment, just like being on a webinar, you want to be in a quiet place so that you can hear. You want to be in a place where you have connectivity so that as the physician's talking to you, you don't drop that call. The next thing about lung disease is really how to self-manage. How can we be better advocates for ourselves? So if that means that maybe I need to practice deep breathing. So maybe I have a strong emotion. Maybe I'm, upset about how I can't visit all of my family. So one of the strategies maybe I could use is practice deep breathing. That's going to help slow down my rate of breathing. It's going to help slow down my heart rate, make it a little bit easier for me to breathe. I could also make sure that nobody is using tobacco near me. So if tobacco is my trigger, I have every right to tell somebody who comes into my house, please no smoking. Or if I'm outside or going somewhere and there's somebody smoking, I can walk in a different direction. So I can empower myself to do that. I'm eating a balanced diet and, really finding support, which is what's so great about these Better Breather Clubs, is because you're not the only one out there. And somebody might have a wonderful technique that might work very well for you. One of the things I want to talk about as well is nutrition and lung disease. So when we are short of breath, one of the things that you guys will all notice is as being short of breath, your heart rate also starts to increase. When that happens, we use a lot of metabolism. So the choice is, do I be short of breath and use my metabolism, or am I going to eat? Well, it's really important we eat. So before you sit down for a meal, make sure you relax. Rest before you eat. If you're having a day where there's a lot of mucus, maybe you put on your vest or use your mucus clearing device, or you're drinking some water to help thin that out and really have some cough so that you can get rid of that mucus. If you're on oxygen, that oxygen will always stay on. You do not take it off for eating. That oxygen supports your heart, and it helps keep that heart rate down, and it helps keep you from not being short of breath. Really important to sit up straight while you're eating and avoid slouching. So I don't know if any of you are familiar with what it looks like an accordion, but if I have an accordion and I have it all the way open, when I close that accordion, I'm going to hear a very loud noise because I have a big volume. But if I have that accordion and maybe I just open it up halfway and then I close it, I'm going to have a very small sound because I'm not using all of the volume. So same with when we are eating, when we're talking, we should always sit up straight to really use all the volume we have in our lungs, all that lung capacity. And then, it used to be breakfast, lunch, and dinner. Well, it's okay to have 4 to 6 small meals, and it's actually better. You can eat those little meals, eat them at your own pace, and really do what's going to work best for you, and to avoid overeating foods that can cause gas or bloating or even reflux. So it's not only important what you eat, but it's how you eat and manage your lung disease. Let me go to my next slide here. So it's physical activity Really important to get up each and every day. If all you did was 15 minutes a day, that would be better than not doing anything. So really important to have that exercise. So maybe just walking to the bathroom. Maybe if you're watching TV, every time a commercial comes up, you get up and you do something. Light stretching, not only does it feel wonderful, but it's a great way to stay mobile and also to avoid exertion because you're doing it slowly, and you could do this while you're breathing. And then if there's things you like to do, by all means, keep doing what you like to do. You may need to do them a little bit differently. You may need to pace, but you can still do them. So if you do enjoy walking your dog and you used to do a couple laps around the neighborhood, and maybe now that's cut in half or even more, it's still okay that you could do that and be okay with having those modifications because you still can be active. And most importantly, the goals that you set for yourself, make them achievable so that you can reach success. And then check out the exercise or virtual pulmonary rehabilitation programs on your TV, online, or cell phone apps, and they too can help you. So here are some of the things that Better Breather members have mentioned how they stay active. So some ride bikes, some do Tai Chi or yoga, chair yoga. I already mentioned walking around the neighborhood, gardening, light stretching. So I'm going to kind of poll our club members, and I'm going to start with Laura. And Laura, can you share, have you been physically active during this time?
Yes, I have been doing chair yoga on Fridays. The pulmonary rehab place that I went to has online chair yoga now since we can't go to the Better Breathers or do any exercise at the pulmonary rehab. And I've been walking around my neighborhood.
That's excellent. The chair yoga, I bet, is a lot of fun.
Yes,
and Karen, I'm sorry. Karen, how do you stay physically active?
Well, I'll have to confess that I haven't been as active as I know I should be. I do, walk a little bit around, the street, not very much, because, I told you before that a trigger is cold, windy weather. Well, right now in Florida, it's extremely hot and humid. So being outside isn't really working all that well for me. I do keep active in the house. I usually manage to get in about maybe 6,000 steps or so, 7,000 in a day, just doing housework, walking back and forth to the mailbox, stuff like that. But I have not done as much as I should do, and I need to get involved with the online exercise classes that I know are online. I should do that.
That sounds great. And I think 7,000 steps is pretty darn good. So I wouldn't knock that, but I like the idea.
Thanks.
And you're welcome. And last but not least, Renee, what are you doing?
I try to take about a 30-minute walk if I can in my neighborhood. But sometimes with this COVID and everything going on for about a month, I was really going through something, having just really panicked about everything. So actually through my TV, I have an app where I can go on. I would try to meditate or do some different yoga, but I try to find something, or I'll try to do something to get some form of exercise because I did not leave my house for probably a month because I was really, with having the breathing issues, the asthma, we have to deal with what's going on with this COVID virus. So it was really scary. I'm starting to get a little bit better, so I'm trying to be more and more active at this point.
Well, I think your solution of finding things that you could do on TV, I think that was a great idea. Thanks for sharing. All three of you, thank you very much for sharing. Next, we are going to show a video that helps you practice deep breathing activities. And so these deep breathing, it helps relax your mind and your body. So this video is 2-minute video. And by all means, that doesn't mean for 2 minutes you guys watch it. I actually am going to challenge each and every one of you to do what they're doing, to actually try to do the breathing exercise that they show you. So without further ado, we will go ahead and watch this breathing exercises.
Pursed lip breathing is a technique that helps people living with asthma or COPD when they experience shortness of breath. Pursed lip breathing helps control shortness of breath and provides a quick and easy way to slow your pace of breathing, making each breath more effective. When you feel short of breath, pursed lip breathing helps get more oxygen into your lungs and calms you down so you can better control your breath. To practice pursed lip breathing, sit down in a chair and relax your neck and shoulder muscles. Breathe in slowly through your nose, making sure to keep your mouth closed. Some people find it helpful to count to themselves. Inhale 1, 2. Pucker or purse your lips as if you were going to whistle or gently blow out a candle. And then breathe out or exhale all of the air in your lungs through your mouth slowly and gently through pursed lips. Try to breathe out longer than your inhale. Some people find it helpful to count to themselves. Exhale 1, 2, 3, 4. Continue to repeat this exercise of slowly inhaling through the nose and exhaling through pursed lips until your breath becomes normal. Pursed lip breathing works by moving oxygen into your lungs and carbon dioxide out of your lungs. This technique helps to keep airways open longer so that you can remove the air that is trapped in your lungs by slowing down your breathing rate and relieving shortness of breath. If you continue to be short of breath, call 911 and seek immediate medical attention. For more breathing techniques and information on living with COPD, asthma, and other lung diseases, visit the American Lung Association's website at lung.org.
Excellent. So I hope you all tried that. If you want to put down your thoughts in the Q&A, please feel free to do that. But I really hope that you all accepted my challenge and tried pursed lip breathing and, see what it could do for you. So next we're going to talk about managing our mood, and especially during these times right now, anxiety and depression, not being able to go out the house, being nervous about what's going on is, it happens pretty common, but it's also just as common with patients who have COPD and asthma. About 15 to 20% will have some kind of symptoms like this as well. So clinical anxiety, that's more about constantly worrying and anticipating the worst in a way that makes it hard to function. That's all you're thinking about. And clinical depression is a deep feeling of sadness that lasts longer than a few weeks. So normally with these comorbidities with anxiety and depression, sometimes they just last for a short while. And if you do start to feel that your mood is no longer in control and it's interfering with your normal life, again, please be an advocate and talk to your doctor right away. And one of the things with anxiety, if I get upset and I'm really anxious, I'm going to tend to breathe faster. My body's going to become a little bit more tighter, because I'm just so anxious. My fist might be clenched, and that's not really helping how I breathe. So this is a great time to use that pursed lip breathing to help calm down how you're feeling. This is talking about managing mood and finding support. And that's really, really important because support is out there. Coping strategies are tools and skills that can help you when you handle stress. And here are just some of the different things that you can do. Reassuring yourself that you will be okay, that today it's just okay for right now, but the afternoon or when you wake up, things will be better. Positive affirmations. Make little notes that say, today's going to be a great day, or I'm beautiful. Any little thing that's going to make you feel better. Podcasts. Online support groups are fantastic, like Inspire Communities. If you have a hobby, if you like to draw, if you're a musician, artwork, anything, gardening, going out there, journaling. I know for me, sometimes if I'm having a stressful night, I wake up in the middle of the night, I can't go to sleep, my mind's just going a mile a minute. I find if I write down what bothers me, I go right back to sleep because then I've taken that stressor, I put it on a piece of paper, I know it's there, and I can go to sleep. So you have to think what works best for you. And remember, there's no harm going outside in your backyard and just looking at the beautiful world that we're in, listening to birds, kind of, smelling the roses, so to speak. So I'm going to ask our ladies again, and I'm going to start with Renee. What is one coping strategy you've used to improve your mood?
I try to, when I feel very anxious, which I have quite a bit the last couple of months, I will normally put on something faith-based on TV, or I'll read some type of book. I love to read, so I'll read a book. I try to sit still, but one thing I do a lot is I love the Hallmark Channel, so I'll try to watch something that's happy and positive, and I'll just sit in peace sometime because I have to calm myself down and really, talk to myself, and I have to tap into my faith, however anyone does that, to realize that it's going to be okay and we will get through this. Because I have had quite a few panic attacks. I'm sure I'm not the only one. So I'm trying to keep myself calm so I don't aggravate my condition.
Well, that's good that you're finding those strategies. And I can promise you, if you follow and you try to do that deep breathing, you can always come back and review that video. That will help as well, and that will help calm down. And then you watch your channel and you see positive light coming in. That will help as well.
Absolutely.
Laura, what's your coping strategy, and how do you use it to improve your mood?
We all are in that last group that's able to go out and be a little bit, less cautious than what we are. So I do have like Renee, I think, was just speaking about having those panic attacks, and I have them. So what I've been doing is, the only way for me to get rid of those is to really go out and walk and exercise a little bit, because my heart is racing. It will slow it down. But I run a support group online for idiopathic pulmonary fibrosis. I also join the Inspire community and Patients Like Me and other social media online groups. I also do Zoom. As a matter of fact, we're having a Zoom dinner tonight where a bunch of us get together, friends, on the Zoom, and it's during dinner time, so we all have our own dinners. We don't have the same thing, and we don't have to clean up after each other. So we do that quite a bit, and we talk about what we're doing and how we're doing, just to stay connected with friends.
That's awesome. I love that you don't have to clean up after each other. That's amazing. And I think when you're having a panic attack and you're using energy, instead of increasing that panic, to go out walking and diffuse that energy that way, that's a great strategy. Okay, now last but not least, Karen, what's your coping strategy and how have you used that to improve your mood?
Well, I belong to quite a few online support groups, so I check in with them, the Inspire community, the COPD Foundation, several groups, Facebook groups. But I also reach out to family and friends, and I'll quickly tell you the thing that perks up my mood the best, but it's only once a week. I have a Zoom with my sister and her 2 young granddaughters, the one of whom has a birthday coming up. She's going to be 6. And she informed me yesterday, it's okay, Aunt Karen, if your birthday present comes late, it'll be okay. And that just made me feel so good. I smiled. I enjoy doing those things. I would Zoom with those 2 little ones every day if I could. But just reaching out to other people.
Although that's really important, and having that support and those smiles. So thank you guys for sharing that. Okay, next we're going to talk about smoking and vaping. So if you smoke, now's the time more than ever to quit smoking. If you vape, now's the time more than ever to quit. We do know that they're both linked to lung inflammation as well as reducing lung and immune function. So all of this can increase the likelihood of complications if exposed to COVID-19. So there's a higher risk as well if you're using tobacco that you're going to develop chronic lung conditions and serious infections with severe cases. So please quit. There's freedom from smoking. There's so much support out there. Please take advantage of that. And then now that we do know states are reopening, so I'm in Arizona. We've been opened since, I think it was last week, but I still stay home as much as possible to reduce the risk of being exposed. And I think patients who have lung disease, think when you go out, what is it that you want to accomplish and how can you do that the best and safest way? So if you have a care plan for management with your lung disease, make sure you keep those medications. Again, contact your doctor with any questions or concerns. Don't shuffle it away. If it bothers you, if it doesn't feel like it normally does, let your doctor know. Really important, wash your hands with soap and water for 20 seconds. Sing happy birthday, sing the ABCs, and then you're done. Avoid touching your eyes, nose, and mouth. Sometimes that's hard when people wear face coverings because they're constantly touching their face, so you want to be careful about that. And if you do have a cough or sneeze, cover that so we're protecting other people as well. Now I'm going to turn it back to Bev.
Thanks so much, Debbie, and to all of our members who made that such an engaging topic. I am excited to share with you guys that we're just announcing today our next patient webinar, which is going to be July 8th. And we're going to be partnering with the COPD Foundation and introducing or re-engaging, depending on if you've done it or not, harmonicas for health. And so it'll be an opportunity to, if you have a harmonica, bring it with you. If you can pick one up, if that makes sense, you can. Or you can just stay and listen. But there's a lot of benefits and a lot of fun when it comes to playing the harmonica in lung health. So I hope that you can join us next month. I would love to share that we have a survey, and so before I switch over to answering a couple more questions that came in through the chat box, there's a survey that when you close out of this webinar, we'll ask you to answer, and that's so important to us. We want to know what's working for you. We want to know if there's any topics that you'd really like to hear about, if there's something about this webinar that we should keep doing or do differently. I did get a couple comments from people in the audience asking for video, for example, of speakers. So we'll definitely incorporate incorporate that next month when we do harmonicas, and see how you feel about it. So if you have ideas, thoughts, suggestions for us, I would encourage you to reach out. Call the Lung Helpline. It's our toll-free opportunity to speak to respiratory therapists and nurses and individuals who can help you answer questions about COVID-19 or your chronic lung disease management, even what kind of air filters to buy for your homes. There's so many different things that we can help you with. Think anything to do with lungs, and we're there for you. A couple of people mentioned online support groups. You can find one. We host 9 of them on the Inspire community by going to lung.org/community and finding one of those real-time online support groups that you can jump into, share your thoughts, just read other people's thoughts, anything that you can do to keep getting that good information going. And so what I'd like to do in our last couple minutes is answer a couple of the questions that came up in the chat box. Okay, so disclaimer, there's a lot of questions that we haven't had a chance to answer, and if we don't answer them in the next couple minutes, I'll make sure that our lung health team follows up with you, so you will get an answer. But we did get a couple questions about going outside, so I'd love to talk a little bit about that. And Debbie did such a great job of talking about how important exercise is for mental and physical health. So what the American Lung Association recommends is staying home as much as possible is the best strategy right now, especially for people who are high risk for severe complications. But if you can go outside and stay away from people, then that outdoors activity is really good. So we want to make sure that we're maintaining at least 6 feet away from people. That might mean if you go for a walk in the neighborhood, you might do it early in the morning when everyone else is sleeping in. Or you might just pick a route where you're able to move safely away from them if they're coming. The mask is really for those areas where you can't maintain that 6-foot distance. And we would encourage you to be wearing that if you're getting close to individuals. There was also a question about what kind of chemicals are sprayed in public places and cleaning versus disinfecting, which is a little bit, it's a really good question. The thing is that cleaning dirt off of something isn't the same as disinfecting to get rid of a virus. And so the Environmental Protection Agency has a list of hundreds of chemicals that are approved to get rid of viruses. And so we want to make sure that those chemicals that you're using to clean your home are approved to do that. And you can find that list on our website. If you go to lung.org, there's our top story is around COVID-19, and it's in one of the facts documents. And if that's too complicated or you don't know exactly where to go, call our Lung Helpline or email them, and they can forward that list right over to you. Or you can get it directly on the Environmental Protection Agency's website, I'm sure, just by Googling it. I think that's all the time I have for answering questions now. So I am going to remind you one more time that it would be fantastic if you could share your thoughts in our survey as you end out. Thank Debbie one more time, and also to Renee and Laura and Karen for offering such great feedback, and to all of you who provided comments in your in the Q&A box. And I hope that you all will be able to join us next month when we grab some harmonicas and have some fun. Until next time, keep well, stay safe, and we'll talk to you soon. Thanks, everybody.